New life will be breathed into the Respiratory Hospital, with officials developing a roadmap to transform and repurpose the facility into the Castries multipurpose medical facility.
The Victoria Hospital or the Respiratory Hospital be repurposed, and it should include the following. That 1, the Respiratory Hospital will be a multi-purpose medical facility comprising primary health services, urgent health care, and a secondary health care facility. The facility will be developed and operate under the theme, 1 patient, 3 services. That the administrative section, former accident and emergency department, the Francis Dolto building, and the area allocated to the Cuban Eye Clinic of the Respiratory Hospital are designated to be designed and operated as the Castries Urban Polyclinic.
Minister for Health, Moses Baptiste, says there will be an immediate phasing of the Castries Wellness Center into the Castries Urban Polyclinic. Additional human resources, he says, will be employed in a phased approach to ensure continuity of operations at the facility.
The operational hours of the Castries Urban Polyclinic will be as follows. All clinics, Monday to Friday, 8 a.m. to 4:30 p.m. Urgent care every day, including Saturdays, Sundays, and holidays from 8 a.m. to 12 midnight. The remaining sections of the Respiratory Hospital are to be managed by the Millennium Heights Medical Complex under the Millennium Heights Medical Complex Secondary Care Wing. 7. The Millennium Heights Medical Complex Secondary Care Wing and the Castries Urban Polyclinic will include an infectious disease unit and a convalescent care unit.
Our story at the Millennium Heights Medical Complex today is one in which we have challenges with respect to available beds to admit patients who cleared for admissions. On any given day, we have between 15 to 20 patients who are waiting for beds at our emergency room. Many of these patients are the uncontrolled diabetics, the hypertensives, patients presenting with cardiac problems, and perhaps the more vexing issue of the injuries from accidents and violence. All of these places tremendous burden on our limited bed capacity.
Chief Executive Officer of the Millennium Heights Medical Complex, Dr. Dexter James, is expecting its control of the secondary care facility to bring relief to the vexing bed capacity issue.
The opening up of this secondary care hospital will provide us with an opportunity to move what we call stable and low acuity patients from the OKU hospital to the secondary care facility and thereby free up some additional beds for us. Will it solve the bed management crisis that we now have? Absolutely not. This is a longitudinal problem that will be solved only when we begin to address the question of the epidemic with respect to NCDs. But certainly it was going to help us expand our bed capacity from what we now have. You recall that at the former Victoria hospitals, we had just about 150 beds.
The move will warrant an infrastructural overhaul of the current respiratory hospital facility.
The Castries Wellness Center, when we look at the utilization, it's used by more than just persons who live in the Castries Basin. Because it's an urban center where people work, a lot of persons who also work in Castries, and because of its accessibility by bus, we get persons from all over the island utilizing it. So one of the concerns that we did have was taking it out of the center of town to a location which is a little further away. So that is one of the risks that we did take into consideration. Presently, there is a bus route, which is the 5F through the mall, which is already available, but in our discussion with the Minibus Association, as Mr. Wadri Ferdinand, we will be meeting with them closer to the reopening date to ensure that the number of buses that access the route will be sufficient for easy access to the facility and back.
The move has been described as a historic development within the health sector and will operate under the theme One Patient, Three Services. Solange Alfred, HTS News Force.